In cancer care, determining whether cancer has spread to the lymph nodes is critical for defining the stage for the cancer patient as well as to plan the treatment for those patients. However, pathologists may need to review dozens of lymph node slides under microscope per patient, which creates significant workflow challenges for them.
The diagnosis that is given out by a pathologist really is the basis or the foundation. Everything that follows after relies on that diagnosis. So whether the diagnosis is right or correct, it will define how the patient is treated afterwards. So that's why it's really so important to really have a correct diagnosis at the beginning of each patient's medical journey.
The ultimate goal of this project is to create an AI-assisted diagnostic workflow for pathologists that will help them to improve the cancer staging and supports oncologists in making optimal treatment decisions for the patients. What makes our project unique is that we are not starting it from scratch. We have already learned from our first experience of AI with colorectal cancer lymph node screening tool. In this project, we are going to leverage foundation models. These are AI systems that have already been trained on millions of pathology images and have proven performance on various similar applications.
This kind of project actually requires a really interprofessional team that has interdisciplinary skill sets. And so it's really important to say that the diversity of the perspective is really important here because it brings the added value. And it's going to ensure that what we're doing really targets the clinical implementation of the thing that we're trying to develop.
Cancer research is always a multi-collaborative team effort involving specialists and researchers from different fields such as medical oncologists, pathologists, surgeons, but also computational researchers. This is very important to reach our common goal to succeed in cancer research and to improve outcome of cancer patients.
So if our project is successful, the patients will receive their diagnosis in a more timely manner. The algorithms help us pathologists to sign out the cases in a more efficient way. Clinicians will be able to treat their patients sooner, and having algorithms helps us to assess diseases or pathologic findings more objectively and with a higher consistency and accuracy.
This grant really aligns so well with the vision that we have on campus about bringing talent, first of all, to Switzerland and having the next generation of students and fellows learn a diverse skill set. So if they come from a technical background, that they can also learn biomedical skills and sort of add on that more medical side so that they can be working together with medical professionals sitting side by side to develop really interesting clinical implementation projects. Really do research with the end point being clinical implementation and having that clinical use case.